You're going to start us off, Roberta.
I am. Good morning, everyone. Again, thank you again for taking this time to set aside for professional development. We have Deb Cates with us today from the Early Childhood Technical Assistance Center. She is our direct contact for technical assistance, and we are just excited to have her join us today. Today, we're going to better understand developmental delay. Aaron Fraser and I both met with Deb earlier this week and went over the PowerPoint and some of the thoughts and concerns that we thought might be helpful with her presentation for you today. And I did forward to all of the site directors the white paper that Deb asked me to do. So you all, if you haven't seen it, you should have asked for it from your site director. That's something that Deb would like you to have as a resource. So again, this presentation is about developmental delay and that disability category that we have in Maine and how that directly affects what we do here in CDS. And I just, again, want to thank Deb for taking her time this morning to do that with all of us here today in Maine. So I have
gosh, Roberta, it is my pleasure to be with you all in Maine. I just love being up there. I think some of you know I grew up in New England and spent vacations in Maine, and even though I live in the South now, I do miss the North and New England and Maine and popovers and all things blueberries.
And we can't wait to be in person with you, Deb. That would be awesome. If we can
look forward to that as well.
If you in person, that would be so much more fun.
It would be a lot of fun. So I just want to verify: are we going until 10:30? Or are we going to take the full time until 11?
We have set aside 9 to 11, but whatever. And so we do have that time on our calendar.
That's great.
Yep.
That's great. That'll give us more time to talk. And,
yep.
And this is really intended to be, it says presentation there, it should say discussion, because there is no one right way to do developmental delay or to approach developmental delay. So my role today is just to give you a picture of developmental delay, what it looks like and how it's being used across the country. And then it's up to you all to make decisions about how you want to take this information and move forward. Some of you may have attended the extended school year conversation that we had. And from that conversation, it was clear that you wanted to take the national resources that exist and really study them from the Maine perspective and endorse the pieces that are most helpful to you and your folks. And so I think keep that in the back of your minds. I think that Aaron and Roberta think that perhaps developmental delay might also be a place that you'd want to think more about it, talk more about it, come to some consensus about how you would want to use it in Maine. And that's what our conversation today is going to be about. So I don't know the timeline for getting grouped together to work on some of this further, deeper conversation, but just keep that in mind. And if this is of particular interest to you, make sure to let Roberta and Aaron know. All right, and with that, we're going to move forward. So I'm sure you're all familiar with the developmental delay regulations from IDEA. And I was working in the state of Tennessee as a 619 coordinator many years ago. Gosh, it's probably been 20 years or possibly more ago when developmental delay was first introduced as an eligibility category under IDEA. And the definition hasn't changed any. It's for children aged 3 through 9 experiencing developmental delays, or a state could choose to use any subset of that age. So Maine has chosen to do 3 through 5 with a caveat about continuing it till age 6 if the child already had that eligibility category designation. And so we'll talk a little bit more about that. But this is who these children are. They are children experiencing developmental delays. As defined by the state, you got to set the parameters around what the actual criteria would be. And as measured by appropriate diagnostic instruments and procedures in one of the 5 recognized early childhood domains. And then, of course, there's always that decision that needs to be made. For any child who meets eligibility criteria, do they need special education and related services? So here's an example. You may have a child that would qualify for visual impairment. However, the child has a great set of glasses and the child's able to keep up with all of his or her work. Developmental progress is great. And so the child doesn't need special education and related services. That same conversation needs to take place for all of our children 3 through 5, even if they do meet criteria. And that's a little bit of a difference from Part C, and that may require more conversation as well. It gets a little trickier when we consider the next part. When we consider children in certain categories, we want to ensure that we're not making them disabled or categorizing them, making them eligible as disabled because they haven't had the opportunity to learn. And so we can talk more about that on another call. Roberta, if you don't mind watching the chat for me, that would be really, really helpful. And I hope the PowerPoint came through.
I did. I just sent it to the directors, and I will keep an eye on the chat box.
Thank you. And please chime in at any time, or we'd love to hear from you. It's always nice to hear other voices, or do use the chat box at any time. So again, as we talked about, the state has to have policies and procedures to ensure that all children in the state with disabilities are located, identified, and evaluated. And so I just highlighted again the rules around child find specific to developmental delay. States may not require an LEA to adopt the term developmental delay. So let's break this down just a little bit. The state has to say, yes, our state's going to use developmental delay. This is our criteria. These are our procedures. Even if a state says that, the state can't require an LEA to adopt developmental delay, right? This is one of these that's certainly up to those folks within local districts as to whether or not they want to use it. But you know, over time, we've really learned a lot about this category of eligibility, and that's what we're going to be talking about. If the state did not give a definition and a criteria and say they were going to use developmental delay, then it couldn't be used at all. But Maine has addressed developmental delay in your MUSER guide, in your regulations. So let's talk a little bit more about your regulations, and Roberta or others may want to chime in here as well. So you've determined that in Maine, developmental delay will apply to children 3 through 5, and then it really mirrors what it says in the federal law, looking at, as required, the 5 developmental domains. The delays must be so significant that they adversely affect the child's educational performance, or that passage, that phrase from IDEA that we as early childhood educators know so well, their achievement in age-relevant, developmentally and individually appropriate activities. So in other words, is this child experiencing significant developmental delays that require special education? And then I highlighted the bottom one because it's a huge statement. It says every effort will be made to identify a child's primary disability under one of the other Part B eligibility criteria, reserving developmental delay for those situations in which a clear determination cannot be made under any other category. And way back when Tennessee entered into the conversations with our local programs about using developmental delay, this was exactly the philosophy that we adopted as well. We will look at some data in a little while, and you can see how other states have adopted the developmental delay category. Some states, a handful, very few, use developmental delay kind of as their first go-to, but that's very few states, very few. And you can see the data on that, and hopefully we'll have some dialogue about what this means. We want to really investigate the other categories of eligibility, talk about them, talk about why developmental delay might be appropriate for more children and which children those would be and why. And this will be a conversation. I'm going to stop talking a minute. Roberta, do we have any questions? Or let's pause and see if anyone has a comment.
We don't have any questions in the chat box, but it was a very, I think it would be good to have the discussion about any other category other than developmental delay.
It's coming.
I know, and which I'm very appreciative of having this discussion. I apologize about my video. My video does not work. I have a new camera, a new computer coming at some point. The ticket's in. I can pick it up sometime this week or next. So I apologize about my video. It's intermittent. So that's why my picture's showing, but I am listening. And so, yes, I think the discussion around and a very clear understanding of what a clear determination would be for any other category and for developmental delay.
So we will be having that conversation in just a little bit. Do we have the capability of going into breakout rooms if we have time?
That would be a Robin question.
Well, Robin, I'm so sorry to put you on the spot, but if you could let Roberta know in the chat if that's a possibility, we might have time to do that. We'll see.
All right.
Thank you. All right, let's keep going then. Okay, I'm going to try and say this, but Roberta's probably going to be able to say this much more articulately than I would be able to, because I absolutely think you were smart to do this. In Maine, a 5-year-old child who transitioned from early childhood special ed into a public school and who was eligible under developmental delay by CDS, and for whom the IEP team cannot achieve consensus on a Part B criteria for kindergarten. In other words, and the team doesn't see a category of eligibility that better describes the child, the SAU may continue the eligibility under developmental delay for that year. Phew, that's a mouthful. Roberta, do you want to add to that?
I can. It's that transition conversation about children who are developmentally delayed going into kindergarten, and what does the SAU need to do in keeping that criteria. It becomes somewhat of a burden to the SAUs, they feel, because they have to consider a different eligibility category before the child leaves kindergarten. So one of the top considerations that we're doing in a user revision is extending that developmental delay age change from while they're in kindergarten to possibly not 6, but 7 or 8. That's one of the things that Erin's looking at in the Muser revisions, because we feel that even in kindergarten, it may be very hard for an SAU to determine what if any, is that primary disability versus continuing the developmental disability criteria.
Great. And today I'm going to be talking a lot about what's happened in Tennessee for a couple of reasons. The first reason is because I really know that progression and all of those conversations very well. And I can tell you things that we talked about as we went through this process, where we ended up in Tennessee, and we have a very nice guide that I believe has been shared with you. We are going to take some time to look at it today. It really parallels what your thinking has been so far. So I think rather than having to reinvent the wheel, it may be a place that you might want to start looking at what's in there and seeing if anything's appropriate for your state. So that's one of the reasons we're going to talk a lot about not just Tennessee, but Tennessee and what's happening in the country, because I think having a national picture can really make your conversation more rich about what developmental delay could look like in Maine and what you all want it to look like in Maine. And so for that reason, I'm going to share that we had some resistance when we decided as a state to adopt developmental delay. Our larger districts, very litigious districts, with directors that really had that in the back of their mind constantly around every decision they made. And they were very engaged in whatever policies affected their children 3 through 21. So I'm trying to say they weren't early childhood specialists, right? And they were afraid of this category. They were afraid, oh my goodness, Katie, bar the door. We're going to have so many children coming in this category. That doesn't need to be the case. And we'll talk about that as we continue to go through these conversations. So if you think that you've heard that, if you've heard that stated before from any of your SAU folks, let's have that conversation about why an appropriate developmental delay evaluation would be a sound evaluation and would really identify children in the developmental delay category. Also, I can tell you that nationally, the numbers of children that are served in Part C are much smaller than the numbers of children that are served in 619 in preschool special ed. The numbers of children and the percent of the population served in Part C and then in 619 continues to increase, right? As those demands become more on children, when we think about that triangle, and I hope you can see my triangle here, from those early childhood outcomes with the base of the triangle being the youngest children And then you widen that gap of what you need to know as you grow older and become an adult. And so there are different things added within those strata every year. And so children's trajectory can change, but it often just goes up and down within a particular trajectory, or within that trajectory or the one next to it. And so children continue to develop and learn, but we have a lot of children identified when it's time for them to walk. If they're not walking, that's a huge, would be in part C, that's a huge developmental red flag. The next biggest milestone is when children should be communicating and talking and requesting things. That can bleed over from 2 and 3, right? Then there's another category, there's another telltale red flag when children should be learning routines and should get past those terrible 2s and start to develop, have good, strong social development, start to develop those interpersonal skills. That's a big red flag for our 3 and 4-year-olds and sometimes our 5-year-olds. Then when children get in kindergarten or first grade, oh my goodness, what they're expected to learn, right? Now, I wish I had the statistic on a slide, but we know that children's language, the number of words they learn between the time that they are 3 and 5 is astronomical. And I've heard it said, and I wish I had the study for you, that is one of the biggest areas for the brain to develop and learn compared to that trajectory. So it's really important that we think about, we're not going to find more children using developmental delay necessarily if we do a really good job, but later on we will find children who when they're expected to read or when they're expected to do math calculations, it may be that then a specific learning disability shows up for those children. But most of our eligible children are usually found by 3rd grade. Would you agree with that? Let me say it again. Most of our eligible children are going to be identified by the 3rd grade. All right, we'll keep going.
I think that's statistically correct in Maine as well, Deb.
Great. So here's the procedure for determining whether a child fits into the developmental delay category. Here are the required steps. You must use a standard measure that looks at all 5 areas of development and should be administered by a qualified individual with formal training and professional standards of the assessment of young children. And your state can either identify the qualified individuals and the formal training that's required, or I should say, some of your assessments that are appropriate for this age level that give you standardized measures will have who they expect and what training they expect folks to have to be able to use those measures. So for example, you may have a speech language pathologist participating in a developmental delay evaluation. They would be someone qualified to use their instruments and their measures. You may have someone using a Patel to determine eligibility. It gives you standard scores in the 5 developmental domains. And the criteria for who can use the Patel is a little bit different than some of the standardized measures that it would take a psychologist or a licensed psychological examiner to be able to administer. So again, there's some room in here for Maine to have this conversation and discuss what that might look like in Maine. I worked for a number of years in my school district as an assessment specialist, and I absolutely love the Battelle. Some people don't. We can talk about that if we have time, and I'll be happy to tell you all the reasons that I do like the Battelle. But let's move on. Criteria for identifying significant delays are 1.5 standard deviations below the mean in at least 2 of those 5 recognized domains for young children, or 2 standard deviations the mean if you're looking at just one area. So in other words, if a child is behind 1.5 standard deviations in cognitive and speech language, that child would meet the criteria for being considered eligible under developmental delay. You still have to have the conversation about, do they need special ed? You might have another child that meets the domain, let's say in social skills, and there are 2 standard deviations below the mean in one of the 5 domains, right? So maybe there are 2 standard deviations below the mean in social skills. or social functioning. Well, you need to have that same conversation. Why is that happening? What does it look like? How is it affecting the child's progress in the general curriculum, or as it translates for young children, in their everyday routines and activities? And we'll get into this conversation a little more later too. Having issues with social skills or behavioral issues does not automatically make you eligible for special education. We have young children, and I'm sure all of you that have had young children or have young children now or have young grandchildren know this very well. I have 5 grandsons, no granddaughters, 5 grandsons under the age of 5 and under. If I were to take my grandsons to the grocery store, all 5 of them at once, and we were standing in the checkout lane, we might have a discussion about how many of those 5 children we might want to talk about their behavior, right? So again, sometimes behavior for young children can be very situational, and we know that. It can be dependent on many factors. It can be dependent on their opportunities to learn. It can be dependent on the structure in which they are participating, or whether they're in childcare with way too many children and not enough supports. Not that childcare would necessarily automatically be that. I'm not suggesting that. They might be in a home family care without the needed support for their disability, whatever. So again, these are conversations that we have to have individually about each child. A very critical consideration is that you have to use the composite standard score in the domain that you're assessing, right? So language, you can have 2 different scores, and motor, you can have 2 different scores, but those scores need to be combined into one, and you're looking at the standard score in that overall domain to make a determination about a developmental area. Let's see if that's clear. Roberta, you want to add to that?
No, that's very clear, and there's no questions in the chat box so far.
Okay, good, great. So, and I really like this. I've not seen this in another state's rules, but I really love this. You require an observation done by a certified special ed, by certified special ed personnel other than the child's current provider. And that observation is to say, here's our assessment, here's what we saw. I'm seeing it too as I watch this child, observe this child in their everyday routines and activities. I've probably told you this before. I worked in a physician's office many years ago. I was so proud of the fact that when all those little 4-year-olds came in getting ready for kindergarten, the physician wanted them to have a screening for how they were performing, because they didn't want their families to be surprised when the children got in kindergarten. And I would take those little 4-year-olds off to the little room where we did our little battelle or whatever we were doing. And families weren't there. It was a room with a tiny little table and a tiny little chair. It was not child friendly. That is not the way to do an observation of how children are performing. And we've learned a lot since then. And as always, the IEP team will determine if the child's delay adversely affects their educational performance. All right. I know that this is very difficult to see. I'm happy to email this to Roberta if any of you want a copy of this. It's not published yet, but we've been looking at the developmental delay criteria by age and state, and this was the best representation I could put together for you. So across the top, the different colors represent ages. Let's see, I've got something covering the bottom of my screen. Let's see if you actually get to see it. Yeah. So the blue on the left are 3-year-olds. Red are 4-year-olds, gray are 5-year-olds, the gold color, 6-year-olds, the lighter blue turquoisey color, 7-year-olds, green are 8-year-olds, and the darker blue, the navy blue, are 9-year-olds. And this chart is organized by states that have children in the developmental delay category based on the ages that it covers, right? So Arizona is the top state because they start with an A and they go all the way 3 through 9. There are many caveats associated with some of these states. So if you do dive deeper into this category of eligibility, I would encourage you, this is about a 2-page report. You can access it here from this link. And you can then see all of the caveats that states have chosen to implement many of them are like the one that you've implemented. It might be for a different age, but they say, if the child comes into us with a developmental delay eligibility from Part C, then they can keep it. In Tennessee, what we decided, and it was a compromise, quite frankly, our special ed directors, the ones primarily from the larger districts, said, we don't want to use developmental delay. And then perhaps begrudgingly, they said, okay, we'll use it for kids 3 through 5. And then by talking with lots of our smaller districts for whom these evaluations, because if you didn't use developmental delay, you almost always had a psychologist involved in the evaluation. Sometimes we were getting behind in evaluations because we didn't have enough people to do those evaluations. They were bigger, more comprehensive, more expensive. And did they need to be for every child? That's a question, not a statement. And so what we decided to do was to say, okay, let's say you come in at 3 and you get the developmental delay, eligibility criteria, stamp of approval. So that means at 6, you need to be looked at for another category, correct? Because it would run out by 6 or earlier if needed. And then at 6, our state said, you know what? If you came in with that and we still can't figure out a better category at age 6, we will let you keep it. And we will let you keep it all the way to, I think it's age 9 unless it's changed. So we took the same kind of stance that you did, but instead of just going through year 6, we said you can keep it. Here was our caveat though. For children 7 years old or in kindergarten, we would not let that be an initial eligibility, right? If a child made it all the way to kindergarten or to age 7 without being eligible for special ed, we said, look at a big B category. You can't use developmental delay. So
that's the same in Maine, Deb. We cannot have the child in kindergarten, although maybe 6 and have just entered in.
The difference would be we allowed them to keep it 6 to 9, 6 to 8, right, 6 to 9. I don't know where they've ended up.
It cannot be an initial determination of developmental delay kindergarten
and beyond. Yep. So we were thinking really the same things when we developed ours and you developed your guidelines. Any questions about this chart? You can see the arrow shows where Maine is. These data came from your data notes in the child count that's collected by OSEP in the 618 child count and educational environments data. And the data manager would have put this note in based on your policy. And my guess is that the 6-year-old column that's golden is checked, even though you go 3 through 5 primarily because children can stay in until they're 6 or in kindergarten. That's probably why that golden column is also checked. And look where Maine falls, smack dab in the middle of where states are. So you have a very sound developmental delay policy, and your criteria of 1.5 standard deviations in 2 or more areas, 2 or more domains, or one area of development and two standard deviations. Sorry, that's a mouthful. That is the middle of the pack for the criteria. That is what most states for 619 are using. There are some exceptions. Part C is all over the place. You might have a 20% delay in one area. That's not a big threshold to meet, right? Or they might be a little tight. And if you work in Part C or with your Part C colleagues, you know that because criteria for entrance into Part C is very different, you don't have to have need. You can have a physician or a nurse practitioner say that this child has this issue, and so it qualifies as a diagnosed condition and you automatically get service. And so the range for what that looks like in Part C, and some of our states actually include children at risk who do not have disabilities, but they're at risk for disabilities. That means that we've got states that are serving quite a few more children in Part C because of their eligibility requirements than other states. And they're actually categorized into broad, I think medium, and strict eligibility criteria. I think there are 3 buckets that we look at when we look at things nationally for Part C. So you can see from this chart that you are right in the middle of the pack with what we've decided to do. All right, let's move on. So this is the Tennessee guide. I'm going to open it up in just a second, but this is my favorite page of the guide, partly because we created it back in the day and it hasn't really changed. So Roberta liked this guide too, and we hope it's helpful to you or something like it. Most of the tools that are developed in states, they're happy to have you take, change it any way that makes sense for you, and use it. There's no need to repeat and recreate things. So when we started developmental delay, what we realized was there were a lot of different evaluators overlapping their assessments with one another, right? And so we were spending a lot of money and we were having a lot of people look at children unnecessarily. While we know that we want to have an assessment that has multiple viewpoints of a child, that's critically important, particularly for young children, we don't have to have a formal, we only need one formal documented score. So that doesn't mean we don't want information from others, but it might be in the form of an observation rather than in the form of another assessment. It so depends on the child. It depends on how clear your assessment is. It depends on how valid, how much you think that that really represents the child. We know that very young children have good days and bad days, just like the rest of us. And, you know, as any evaluator should, we have to sign off on, yep, we think this really represents the child's functioning. We've talked to the family, they agree, we have an observation, we've seen this child in a more natural environment. We think this is a good representation of where the child is functioning. So what this means is, if you decide you're going to use a tool like the Battelle that's organized specifically for young children, and it's in the 5 developmental domains, you might have a speech language evaluation along with the Battelle, right? Well, then there wouldn't be any reason to do the communication section of the Battelle. You could do it because you needed more information, or you could rely on what the speech therapist can be putting into that column for you. Same thing as if you're looking at social, emotional, and for developmental delay, it's social emotional development. It's not emotional disturbance. Those are 2 different categories, and we'll talk about those in a minute. So when you're looking at the social emotional development of young children, you're looking at how that child is doing in everyday routines and activities, taking into account where the routines are happening. Is the child all of a sudden in Head Start, for example? They've been in home, they've been able to do pretty much, you know, things on their own time frame that's worked out well for them. Now they're in a structured situation and they don't know what's expected of them. And, you know, sometimes Head Start has to have those evaluations done in the first 45 days. And a child might look different in the first 45 days in a classroom they've never been in than they would look later on in the school year. So again, we want to think about what makes sense when we're getting a score in this category. You may have somebody that's doing a Vineland for you, doing an observation with that experience of what does typical social emotional development in young children look like. Well, then maybe you don't want to use the Battelle to get this domain score. Does this all make sense?
Yes, you and I and Erin talked yesterday about this chart, and we just thought that we might have put a work group together to adapt this to for Maine. It makes a lot of sense. So we just had a question come up. It says, when considering motor standard score, can an OT evaluation be used, which may provide a FM quotient or a full motor eval?
You need to have motor represented in that full domain. So it depends on what assessment your OT is using, right? So in that case, maybe they're giving you some information, but if it's not representing the entire domain, then you would want to do something like a Battelle. However, think about this too. If you've got more in-depth information from one provider, but it doesn't meet the threshold that you need to get a standard score in the physical or adaptive domain, then the Battelle allows you very quickly to just do that one domain. And if you even happen to do the screener as part of your standard work, I'm not suggesting you screen every child, but I think, and we can talk about this more if we have time as well. In one of the states that I've been working in, we worked really hard for a long time to really talk through child find, particularly for our kids in regular early childhood programs. And one of the things that came up was the child care folks, the state pre-K folks, the Head Start folks, everybody said, We know who to refer when they have a real obvious delay. We don't know those kids in the middle that we're just not sure about. And so they just didn't know, should we wait and see? Should we refer them immediately? Now, again, sometimes your philosophy plays into this, but one of the things we did there, and I can get this to Roberta if anyone's interested in seeing it, we took the CDC's milestones. They have milestones that are absolutely wonderful, and they have a red flag checklist for all the developmental ages, right? So I think it's with 6 months increments for young children, and then it goes to yearly increments for older children. So it shows you with about 10 bulleted points what a child should be doing at age 3, 4, 5, and it even goes lower, and then it's got 2 age ranges. And it's, of course, not everything a child should be doing, but not only does it have that, it has red flags. If your child is not doing this by this age, you need an evaluation. And so we condensed that into a form that looked a lot like this, so that you could use something like that when you were doing an intake or having someone call up. You could even probe the child care provider, you could probe the family to see, do we need to go further? Depending on what you learn from something like that, you may want to start with a screening, right? So once a family has requested and given consent for evaluation, it's a formal evaluation. But while you're talking with a parent, while you're probing whether or not a family or a child needs an evaluation, you want to use all the tools at your disposal to make a good decision about, does this require an evaluation or not? I don't know if your state takes data on how many children are evaluated versus how many children are found eligible. In the state that I was working with, one of the reasons we really dug into Child Find to create some of these materials is they had a 40% not eligible rate, and they were doing comprehensive evaluations. Speech was even higher. And so that really helped for the state to really share information on how to determine who should move on to an evaluation and who didn't, who you might wait and see about. Again, with the caveat that once a formal assessment is requested and it's in writing, unless you convince the parent that it's okay to wait, that has to happen. Is that okay, Roberta, or do we need to clarify more?
No, that's good. And we have another question, but before we do that question, I have a request for the checklist. If you
oh yes, you have the link to the checklist. I'm going to take just a minute here. This is always so scary. I'm going to close out the PowerPoint. I want to show you this document.
And I do have another question when we're ready.
Go ahead. You go ahead.
Okay. The question is, would receptive language composite score or expressive language composite score be able to be used independently, or would it have to be a total language composite score?
It's a total language composite score. Now, that might not, if you use one or the other as a speech pathologist, you might have a child eligible in another category, speech language delay, right? But for developmental delay, you look at the composite score. So you would look at expressive and receptive language. And let me say, some of the philosophy around this is, think about stepping back, looking at the entire child for developmental delay. What we're saying is, something's not right. This child's not developing the way we would expect them to. We're not 100% sure why that is. We're going to stand back, take a high-level view. Let's look at the developmental areas in which this child is struggling. Let's dive deeper into them if we need to, but let's step back and look at the child. So the way I like to explain it is, think about each one of these specialists taking a snap, and it might be one person, right? It might be a generalist that's taking these snapshots, somebody that has special ed experience that your state says is qualified to use the Battelle or similar tool. And so each of these domains is a snapshot of how the child is performing, right? You get your snapshot, you get confirmation through observation, through talking with the family. You talk about how that snapshot you have of the child is affecting their ability to learn and their developmental progress and any related factors. And you put all of those snapshots kind of in an album or out on the table. And then what you're going to do as a team is you're going to say, is one of these snapshots of the child a better place that we should be following up with to make our determination of eligibility? Or as a team, we want to pick out that snapshot that best represents the child. But we are going to talk about when we're not sure why it's really critical not to put a child in a category because a different category, because there are ramifications. And I hope that answered your question. All right, let's see, I've got to stop sharing my screen for a minute. Okay, I believe I have this up for you. No, of course it's not. I'm going to show you how I'm searching for it. I'm going to share my screen and you can see how I'm going to search for this tool. You also have the link. Roberta has the link.
Is that the Tennessee document you're
It is the Tennessee document, but I do want to go to it and show it to you.
Okay.
So I'm going to Google it, Tennessee Developmental Delay, Eligibility. You guys have the direct link. It comes right up. Oh, and actually, I think that was a better link right underneath it. This is the Tennessee education page, and then you go to Disability Evaluations and Eligibility. I think you have the direct link, but if you get to this page, this is where you go. Here's our guide right here. And you can get it in a doc form, which makes it really easy for you to just make all the changes you want to it. This is what the document looks like. And I'm going to scroll through it because I think it's worthwhile taking just a few minutes for you to see what's in it. It may not represent your thoughts, which is fine. You don't have to accept things that are in this document, just showing it to you so you get a feel for what's in here. It was updated in, I believe, 2016, but we did this document about 20 years ago. We've got a section on the definition, pre-referral and referral considerations, what a comprehensive evaluation looks like, eligibility considerations, of course, you can see the rest, re-eval. There's an assessment section. Oh gosh, I didn't put this in this presentation, but Kathy Hebler, who leads the DAISY, the data center, the IDEA, Early Childhood Data Center. She is a PhD psychologist. She has a great list of tools on the ECTA website that can be used both remotely and for young children. They detail all the tools, how they can be used remotely, and which ones give you standard scores. I should have included that as a resource. I'll make a note to try and send that to Roberta. Okay, let's see here. Let's keep going. There's a teacher observation form. You probably have plenty of those. Whoops. There's an adaptive behavior observation. Developmental delay calculation. Ooh, I forgot that was in there. Let's see what that looks like. I wanted to say that you might have noticed on that tool that we had, oh, this is what it looks like. Okay. We had both standard score and we had percent delay. And let me tell you why we had that. We accepted either or. We required the use of the Battelle in Part C at the time. I don't think they do anymore. But if our folks in Part C used the Battelle, they always scored it as an age score, percent delay based on age. Our folks, they didn't know how to do standard scores, and our folks in Big B didn't really know how to do percent delay. And so rather than recalculating, we went back to the Battelle and asked them to please make us a chart, because we wanted it to be official, of how those two scores would translate. Now, for those of you that do assessments, you know that they don't translate perfectly. 25% delay is not always a 1.5 standard deviation. 40% delay is not always a 2 standard deviation, but they're very, very close. And so we decided, for the sake of being able to accept each other's evaluations, that we were going to allow that interchangeability. So I just wanted to mention that. All right, I'm going to go back. Let's see if I can do that. I'll just close this out. It's always interesting to know what we're going to find here on this site when you see my screen. I guess I closed the whole document. So let's go back to that. And I'm going to scroll all the way to the very end. And this is the last thing I'm going to show you. So please look away if scrolling makes you dizzy.
I'm going to send the directors that link right now.
Great. I want to show you where to find that tool. Oh, it's, you know, this is not great. The appendix on the factors worksheet. It's okay. You might want to update that a bit. Go scroll all the way to the very last page. Uh-oh, it's not there. All right, where is it? It's H. Okay, it's in the PDF form. Let me go back the other way. Close this one. Let me go back to the PDF. It's in there, I promise. We just have to find it. And if it's in the PDF, I'll make sure that we get it to you un-PDF.
It's in the one that you sent me, Deb, so I'll just make sure
Okay,
that's.
sorry about that. It's the last page in the one I sent you. Okay. Let's go back to the PowerPoint. That really wasn't very helpful. All right, let's see where we are here. This is the backbone of how we do these developmental delay evaluations. You have the DEC Developmental Delay Concept Paper. This was put together in 2009, so it's been out there a long time, but it's based on states that started adopting developmental delay and what we know about developmental delay. And so it's a very simple 2-page document, very easy to read, but it talks about the critical factors around developmental delay and why it's important. All right, developmental delay. The reason that it's a great category, it's based on a child's strengths and needs as measured in the 5 developmental areas. And for young children, that best captures their developmental progress, right? When a child is in kindergarten and beyond, we're really more focused on academic areas and how those academic areas are impacting that child's functional ability, right? So it's a little bit different. But when we're looking at a young child, they're not expected to read yet. They're doing pre-literacy skills. They're doing developmental skills, and they're making progress in all 5 of those domains. And those domains are so interwoven, it's really hard to tease them apart. It's really meant to be used when a more specific disability may not be accurate, although as we've talked about, some states are saying, you know, we like this better than any other, so we're going to use it for most all of our children. In the concept paper, they really drill down into the reasons why school age eligibility categories are often inappropriate for young children. They can represent premature categorization or miscategorization of children, and they can be very inappropriate. They also may not identify young children in need of IDEA services. Now, that kind of contradicts what I said about you're not going to find tons more children. I don't think we will. I think we'll find the right children. If we use the right tools and the right process, I think we're going to find the right children. And we know that when we get to children early, some of them their developmental needs are going to be met and they're going to do really well. So there's that trade-off between those children that as they need to learn more, their delay becomes more apparent, and those children for whom a little support at a young age was what they needed. I'm going to stop and see if anybody has a comment about anything they're seeing here.
So in our chat box, it says, we often use the fine visual motor score from an OT eval as motor delays without considering the full motor score and gross motor included.
Yeah, and motor score and looking at just motor is really not appropriate in that consideration, right? And we've got a slide coming up that looks at all the categories. If a child only has motor issues, depending on what they are, if a child, let's say a child has cerebral palsy, and the child is, I'm thinking of a child and I can picture him, and he's doing amazingly well. He's able to speak, he's able to communicate, but he can't walk. He can't use his hands very well. He's really struggling in that area of motor. But what does his special ed need? Because he's able to scoot around the classroom. He knows words in books already at 4.5 years old. He's very articulate. The child has cerebral palsy. That might qualify as a health impairment, right? He also has significant motor delays. Is that child eligible for special ed? In the case of this child who could not walk, no, he wasn't eligible. But again, if you were just looking at a motor score in isolation, you might make him eligible. So we really want to, again, step back and look at what's going on with that fine motor score that might make a child eligible for special education, right? We want to look at the bigger picture.
There's a little bit more to that question, and it says,
okay,
what is the combined motor score on the BDI What is the combined motor score on the BDI is not 1.5, but on a fine motor score on the Peabody is significantly delayed.
So it's significantly delayed based on the tool you're using, but for developmental delay, you're looking at the combined motor score, right? So you're looking at fine and gross motor, and you're looking for that total combination score. If you're looking at just a smaller component score, that's really not what we need to be doing for developmental delay. Did that answer your question? And again, that's why it's important to look through these tools and have these conversations together as a team.
I think we're good, Deb.
Okay, we'll keep going. So here are traditional Part B categories of eligibility. And put in the chat, either by, you can use the initials for the category, or you can use the number for the category. Which categories would you say are not appropriate for young children? Generally speaking, which categories of eligibility would you think are not appropriate for young children? If you wouldn't mind throwing a number or a word in the chat.
I'm gonna take a tally on those for you.
Okay. Just read out what you're seeing.
I see 11, 7, 5. I see 11, a 5, 11.
Emotional disturbance, absolutely. A 1. Autism, we're going to talk about that. 7. Intellectual disability, absolutely. With a caveat. What else?
I see 5, 7, and 11.
Oh, 5, 7, 11. I thought you said 1. Sorry, I tipped my hand.
Nope.
Okay. 5, 7, and 11. You guys win a gold star. Those are the categories that really are not often used for young children. And let's look at what that looks like across the country and why. Oh, let's see. I've got yours. The green bars here are the eligibility categories for children 3 through 5 across the country. Now, these data were pulled from the 1920 Child Count and Educational Environment 618 data collection. For those of you that are really steeped in the data, that data has kindergartners in the count from some states and no kindergartners from other states. About 37% of states, I don't know what that number works out to be, about a third of states have the kindergartners removed for this count. The majority have them still in. So this may be different, and those of you may have seen some of our data from an earlier presentation that looked a little different, and that's why this is newer data. Look at what's happening in the country with DD. 42% of children being served across the country are being served in developmental delay, in the category of developmental delay. There are 4 states that don't use developmental delay. I believe it's 4. It was in that chart I showed you and I forgot to mention it, but I can show you in another slide coming up. Look at speech language across the country. It's 38%. Other health impaired, generally what's in other health impaired are those children that have attention deficit hyperactivity disorder. That is the overwhelming condition within that category. Nationally, it's at 3%. Last year, it was 2%. This year, it's 3%. Autism nationally is at 11%. And then you can see that there's not much difference between, there are very, very few children within those other categories of eligibility. So you absolutely got those questions right. But now let's look at where you're different than the national landscape. So you don't use developmental delay, and so Maine's percentages are in blue. You have a lot more children in speech language. Could they have more global delays? It's a question, and it's not meant to say you have to do things differently. But look at OHI. We're going to look at that in relation to the rest of the country because you are very high in that category of eligibility. Maybe you want to talk about some of those root causes or the underlying reasons for why that is. And then similarly in the area of autism, you are very high compared to other states, and we'll talk about that. The reason that this is so critically important, and I am not an expert in this, and I found this out quite accidentally through personal experience. If you have a diagnosis, even as a young child, of ADHD or autism, you can't get into the service without going through a very special process. And maybe it should be that way, but again, these eligibility categories, even if they don't rise to the level of a diagnosis, can have long-lasting life effects on children and families. When we tell a family of a child at age 1 or 2, your child has autism, that is a spectrum disorder that cannot be mediated away. It's a disorder that that child would carry throughout their entire life. I don't want to use the word symptoms. Can the issues that they're having based on that eligibility category and or diagnosis, can that be remediated? Absolutely. You probably work with people that you think are on the spectrum, right? I like to say, I'm going to whisper this one. I like to say, I know some folks that probably as younger children might have been on that spectrum. But it's just so critical to know that because it's a spectrum and because we serve children under IDEA based on what they need, not what their category is. You do not have to have an autism diagnosis or be in that eligibility category to get the remediation, to get those skills, the services that you need. Now, it is true that you might need a medical diagnosis to access funds like Maine Care. That's a discussion, though, that I think you should have within your state of what that looks like and what that means. Because, like I said, there can be some very significant ramifications to using those two categories of eligibility. Category of other health impaired, particularly attention deficit hyperactivity disorder, can be similar, right? If they're in that category because Maine Care will reimburse it, maybe that's not the best reason to have them in that category. But again, I think it's going to require a lot of conversation, a lot of looking at children, a lot of thinking about this. And I'm going to stop here for questions.
We don't have any at this point.
Okay. So here's how your other health impaired eligibility category breaks down with other states. Now, if you look here, we've got Ohio, Puerto Rico, California, Texas, New York. These are the high flyers, and you're double what any other state has. Most states are down here under 2%, some 3, but we don't have many states here. And you can see that California and Texas, being as big as they are really impacting these data. And Ohio, to some extent, is a big state, serves lots of kids. So I think that bears looking at, right? Would you agree?
Absolutely.
And here are the percent of children with disabilities in the autism category and those that use developmental delay. So let me explain this chart. Green are the percent of children that are being served in these states in the category of developmental delay. You can see down here at the right in the blue represents children in the autism category. California, Puerto Rico, and Texas don't use developmental delay at all. Look at California and Texas and their rate of children with autism. It's much higher than the majority of these other states. Make sense? So it's just something to consider. Here's where you are right here. So the 4 states that serve, well, I think I have this on another slide where it might be better. You can see it better. Do I need to leave this up for a minute, or is this slide pretty understandable?
Hey, Deb, could I ask a question?
Sure.
It's Lori Whittemore. So I'm just wondering, I think that we refer for psychological evaluations where a young child may get a diagnosis of ADHD because the BDI doesn't capture the child's needs within those scores to find them eligible under developmental delay. So do you have suggestions for how to, like, supplemental tools, or how should we approach that so we could keep them?
Sure. So I'm going to put my bias out there. My bias is that I really like the tool, and I think it is really appropriate to look at the standardization of that tool. If that tool's not enough, there are some other very good behavioral tools that psychologists can use that would give you a domain score. But I'm not sure that the end goal is to make those children eligible. I think the end goal is to really look at those factors impacting the child. Are there supports that could be universal supports that could be used to help children that might be in the category of other health impaired? Does it rise to the level of a true disability, or is it one of those things that with the proper supports that can be provided in any classroom, that child would be okay? So I'm thinking about how many of you are familiar with the pyramid model for social emotional behavior?
I hope we all are.
Okay, good. So you know what that pyramid looks like, right? Before we put a child in that OHI category, we really want to look at, have they had access to those universal, those base supports? When we put some specialized supports in place for them, how do they do? How do they react? We really want to reserve those kids at the top for not just jumping right in, but for those kids for whom nothing else has been working, and we really need to keep diving down. I'm also, while I did work as an evaluation specialist, I'm not a psychologist, but I do know that there are tools that psychologists can use, like a Vineland, that would give you some scores in that area that might help look at how that children's performing, and most importantly, why. One other thing about young children that have a lot of energy, and I own one. I have an adult child that's in that category and was diagnosed and had an IEP all through school. I was told this at an IEP meeting, and it really resonated with me. When we put children in school and we expect them to sit and learn in a particular way, for those children with lots of energy, whether they rise to the level of other health impaired or ADHD or not, we are making it hard for them. These are the children, or these are the people that in times before we had school, or even some of the people now, if you look at the list of famous people that have attention deficit hyperactivity, you can Google it and have it come up. They're sometimes the most creative people, but these would have been our people that got in a covered wagon and ventured out west. Their strengths are in their energy and their other abilities. So again, it's an appropriate category for some children, but maybe it bears looking at, is it an appropriate category for 12% of your children? Anybody want to comment? I think this is really good. We're not having much discussion. I'm doing all the talking. Let's see if anybody wants to comment here.
Deb, I think we're at a disadvantage in Maine in that we don't have universal preschool. So, you know, we get a referral from a childcare, which probably isn't that great, and the child having all these behaviors. And if we assess them, we're seeing that. If we're doing rating scales from the teacher, they're bombing. And so we're looking at eligibility, and then we do a psychological, and then it just kind of goes down that road where I agree with you.
Lori, so is this Lori again?
Yeah.
Lori, one of the things that could be done when you look at the Battelle, if a child has a 40% delay on the Battelle, then they would be eligible just in that category. If that tool, if you feel like that tool is missing some children that need to be served, again, once you've done all those other types of strategies, then there are other tools that can be explored. I'm not an expert in that, but I think we could find some people to have that specific discussion with you, because we know that in other states, they're getting that done, right? In most states, they're getting that done. And so I think it certainly is a conversation we should be having. And maybe we could bring in another expert that could talk more specifically to that. We can get a psychologist that, or someone from the Pyramid Center that's a psychologist that could really answer your questions better than I can.
So Deb, this is Denise Howell. The other issue, and to piggyback on what Lori said, is that many of the kids that come to us are maybe in daycares or private preschools or programs where there is not, those teachers may not have the education or knowledge or desire to provide those supports for those kinds of kids. We don't have an RTI really expectation. We do ask, what have they tried? What has worked? What has not worked? But many of them don't have an answer to that gives us good information.
I would absolutely agree with what you said, Denise, but then the question becomes, are we going to make a child eligible
Right.
as having a disability when it's their program that's not able to support them? You'll hear me using this comment quite often, and it's meant to be a conversation starter because it really requires conversation. Programs shouldn't have to be, children shouldn't have to be ready for programs. Programs should be ready for children. Now, that's a big statement, right? And it's meant to spark discussion, but we shouldn't be checking boxes for if children are ready for kindergarten, let's say. We hear it all the time from our kindergarten partners. This child's not ready. Well, my response to that is, we have to be ready for this child. So I know that's an easy statement to make, and it's not that easy, but also think about it this way. Putting that label on a child can be detrimental. It really can. Children taking drugs at 3, 4 years old can be detrimental. They also can be needed. So I'm not saying that it's just one size fits all, but I'm saying it bears conversation. The other thing I would think about is, let's say a child's not eligible. Let's say the child's struggling in childcare, but you've gone in there and you're saying, wow, there's no structure here. Maybe it's worth your while. You can use your IDEA dollars for this to provide a little structure for that classroom and help that childcare teacher. What we know about children with disabilities in childcare programs is whenever we're working collaboratively, program quality improves, whether the child's eligible or not, right? Now that goes both ways. I know in Maine, you have a lot of your early childhood staff are early childhood specialists. In most states, your early childhood folks are special educators first, and their early childhood specialists second, if at all. And so what we learn as special educators, and I'm an really old one, and so I wasn't trained when we were serving 3, 4, 5-year-olds. And so I was trained in special ed. I was not trained in early childhood. I had to go back and learn early childhood. And I've learned a lot from my regular early childhood teachers. So your point is very well taken. But again, I think it really requires a very in-depth conversation about why this is happening, that you're at 12% when the country is not. And are there other ways to serve these children with or without making them eligible for special education? As all of our Part B partners know, a child that has issues with emotional disturbance, right? Because there is no other behavior category. So a child that has behavioral issues or is maladaptive, I hate that term, don't you? Mm-hmm. It doesn't necessarily make you disabled. And so I think it's a conversation that bears happening in early childhood as well with the right people. And I'm not the right people to dive deep into that, but I can get you one. We can invite somebody that could have this conversation with you.
Absolutely. We do have a couple more questions too, good. If you want to.
Yeah, we've got plenty of time.
Yep. So it says, what can be considered from a BDI? Meaning, if it is done by a special education teacher and reveals a moderate delay in communication and we need speech therapy, even if the speech therapist did not do the BDI.
Yeah, your speech folks can do their own evaluations. If a child is eligible, well, and this is going to depend on your state rules, right? If a child is eligible for developmental delay, you know, when you have to put their strengths, their needs, and then you check next to the needs, or however you do it in your state. If they have a need, you provide a service, right? So your state may have rules about how you define the need and what tools were used to define the need. In my state, once you're in that developmental delay category, once you've written those strengths and needs, if you've written a communication as a special ed teacher, not a speech pathologist, if I wrote this child has communication issues and I checked it, we didn't need a full speech eval for the purpose of putting the child in an eligibility category and for the purpose of providing services. We went right to the services page. Now, the speech pathologist did whatever assessments they needed to do to provide service for the child, but they didn't need to calculate a base score if the child needed help in communication. Most often, you know what it was? It was absolutely using a communication board, using their language. It was those sometimes unquantifiable or difficult to quantify skills that 3-year-old children have. I'll give you an example of that. When my youngest daughter was 3, my oldest daughter was 3, she was in a preschool, 2.5, I guess. She was in a preschool. I picked her up after school one day. It was November. She'd been in school since August. She was a little bit over 2. I picked her up. She came out and met me. She said, "Mom, hurry up. We got to go home. I have to use the restroom." She didn't like going to the restroom at school. Her teacher came flying out of the classroom and said, "We were trying to make a referral. We didn't know how to approach you." We've never heard her speak. That's not uncommon with young children in new situations. But August to November, she didn't speak in that classroom. At the time, she was a very shy child. She's not anymore. So again, situations are critical. But no, you don't necessarily, unless your state requires it, have to have that standard score from a speech pathologist.
And then we have another question back to the social emotional. It says,
Okay.
I use the DECA, which gives a standard score for social emotional development. This is used in conjunction with the BDI if needed. So that's a statement. So
Great. Great.
Nothing else in the chat box, Deb.
Okay. Roberta, do you need to clarify anything about use of a speech language evaluation? You know, it's like there's evaluation for eligibility, and then there's evaluation or assessment for services, right? We have that concept, right?
Right. And so in Maine, as you know, speech and language is a standalone disability category.
Yep.
So that in itself, we do have a criteria that is necessary to do that. And we have a form, a required state form to do that. Lori adds, we require SLPs to do an evaluation for the speech therapy.
For standalone speech therapy.
Yes,
Or
that is.
for any speech therapy.
Yes, that we for a standalone speech and language disability, we require an SLP to do that evaluation.
Absolutely. It would be very difficult to use a Battelle, find a child 40% delayed in communication and make that make them developmentally delayed. That obviously wouldn't be the disability category that best describes their need, the eligibility category, excuse me, that best describes their need, right?
Right. Interestingly, in Maine also, if the child is dismissed from a direct speech and language category, the team can determine to continue speech and language services as a related service if it benefits the child in that learning environment, but it's a related service, not a direct service. So that's a little bit ambiguous, maybe.
Great. And you know, most states, I don't even know that there is a state. There used to be. I don't believe there are any states anymore that don't have speech language as a standalone service, even though it's a related service. However, other standalone services such as OT or PT are absolutely not allowed
Correct.
to stand alone. If the child just needs OT or just needs PT, that can't happen under IDEA. They're not eligible for service under IDEA.
It's my understanding, Deb, that I think Maine is one of 3 states that only allows speech and language as a standalone disability, unless that's changed.
No, most states do, Roberta. Most states do.
That's new. That must have been, I'll have to do another research on that, but that was our understanding a while ago because we were considering.
Yeah, no. Most states do have that category of eligibility
Roberta,
as a standalone.
can I just clarify, because I know this is going to open up a big can of worms for people. So because the question was, can a teacher do the BDI and identify a communication delay and authorize direct speech therapy? My understanding is a speech pathologist would have to be on that BDI team for us to authorize speech therapy. Is that correct?
That is correct.
Okay.
So that's a Maine rule, and that's very well taken. So thank you for that. Let me give you a scenario where it might look a little different. Let's say that I'm working with a very young child. They have significant developmental delays across the board. Perhaps it's a child with Down syndrome. Perhaps it's a child that has some characteristics that look like they're looking at autism. But this is a very young child and you're just starting work with them. Developmentally, they have a few words. They're not using their skills to communicate, right? And that happens with lots of children. Sometimes it can even be cultural. There are cultures in which children aren't expected to speak a lot when they're young, right? They're expected to just be there and be seen and not heard. And that's absolutely true in some cultures much more than others. And certainly at my grandmother's dinner table. But for those children, it may be that you're making them eligible as developmental delay, but you want your speech pathologist to be involved in what that child needs for speech and language. So in your state, you require that they do an evaluation and participate, but maybe this child only needs some consultative services to get going with using their communication skills in the classroom. Like my daughter, who had perfect communication skills, she just chose not to use them in the classroom. So maybe it's a situation like that where you might not have full-blown speech language services in your state be allowable, but maybe there's some consultation or some observation going on. All right, let's keep going. These are great questions, and thank you for these, and especially for grounding us back to what Maine requires. So here's the autism eligibility category, and this is for 1920. So you've gone down a little bit. You were above Texas before, but now Texas has climbed up over you. So it's California first with 30%. Remember, they don't use the developmental delay eligibility category. Using that category should not prevent a child from getting the IDEA services that they require. Texas, same thing, huge state, 25% of their children, a quarter of their children receiving services 3 to 5 are receiving those services in the category of, in the eligibility category of autism. Again, they do not use the developmental delay category of eligibility. Maine does, and Maine does identify quite a few children as developmentally delayed. They were a little bit more toward the middle of the pack for developmental delay, but they're serving 23% of their children in the eligibility category of autism. And then you're next, followed by Nevada, Connecticut, and Delaware. The percentage across the country is 11%. Now, let's think about this. If California and Texas and Maine use developmental delay category a little more widely, would their numbers look different? And would it also impact this number because California and Texas represent so many of the children that we serve? Again, not saying there's any right or wrong answer, just saying this is the overarching picture. No questions? We'll keep going. All right. Now let's have a conversation. And Roberta, I'm going to ask you and Robin, would you like to have this conversation in small group and then come back and talk together? Or do you want to keep going as a whole group?
I think we'll have to keep going as a whole group. Robin has not yet figured out how to do the small group, but we will definitely make sure that we have that available next training in May.
Okay, and I apologize. I should have told you that too.
Oh, that's fine.
All right, let's really have a conversation here. So let's take a minute. Let's take about a 2-minute, it's going to feel awkward. Let's take about a 2-minute reflection time for you to jot down some notes about what are you thinking about your work personally and your program practices. So please, let's take 2 minutes. I'll time us on a clock and jot down at least 2 or 3 things that you think about based on what we've talked about. Even if it's, we're doing it okay, we don't think there's much to think about. But please do write down a reflection.
And they can put that right in the chat box. And what
Yeah,
I think
I'm going to ask you to write your reflections down and then pick one to put in the chat. Absolutely. Thank you.
And Deb, why don't we do this? Why don't we just say for the next 5 minutes so that people can actually get up and take a break if they want to, but we'll say that by 10:27 that we would expect that in the chat box. How's that?
You know what? Let's do this. Let's take a break. I'm going to pop these questions into a Google Doc and we can actually type right on it. So let's take a 5-minute break.
Perfect. Thank you, Deb.
All right. Thanks, everybody. We'll come back at about 10:30. That was a great thought, Roberta. I should have thought about this earlier.
No problem. You've been going for quite a bit. It must be hard on you too. So maybe if you need a quick motor break or water break or whatever too.
Let's see here. I'm going to get this into a Google Doc. This will be fun. I should have thought about this earlier. I love Google Docs. Can your folks use Google Docs? There's no prohibition on it?
I'm hoping so.
Okay.
State employee, some of us, I can't, but that's okay. But where most of these are non-state employees, but have state.
Okay. Oh, that's good to know. Well, next time I'll make like a smart board or something.
No,
but
this
for
is
today,
fine.
the Google board is the fastest.
Yep. We've done other types of.
Okay, good.
But this should be fine.
Yep. So I hope it hasn't sounded like I've been very judgmental. That's not my intent at all.
No, I think this is all good. I think it's been very well
Okay.
from what I
Okay,
can.
good. Oh, shoot. There we go. Oh, I talked to Heather. The call that is with PCG is about Maine care billing. It's not our group.
It's my understanding it is us on Wednesday because we were told it's on our calendar.
Oh, is PCG invited?
Let me look at the bill, Deb.
Okay. Oh, okay. Then I misunderstood totally what you were saying it was. Are you just inviting us to listen in?
Well, I think it's a work group, and
Okay.
a work group, and that sometimes hold on. I'm going to pause our conversation here. Okay, we're now recording, and so
Right.
you're sending out the Google Doc, and are you going to share your screen?
Yep.
Watch
Yeah.
the Google
Do you see
Doc?
it right up here? It says from me to Rob. I don't know why that's like that. Let me do it to you, everyone. Let's try that again. That didn't work. To Robin, it went to Robin instead of everyone. Let's try that again.
All right. So if everybody pulls up that link,
They should be able to type right in the document.
then you
Now let
can.
me share my screen. And as they come in and put their comments in, we'll all be able to see them. And they're anonymous, so we want to let people know that.
Yep.
We have an anonymous dinosaur, an anonymous goose. These animals are really sometimes fun.
Yep.
Dumbo octopus. That seems a little. Why is Dumbo in there?
That's just how the Google Docs assigns people. It's very interesting.
I know, but none of the rest of them have a modifier. And we have an anonymous dingo. Welcome back, everybody. If you wouldn't mind reading the 5 questions, and please put a comment in each of the boxes. Your comments are anonymous, and we need them in the boxes so that we can continue our discussion.
While they're doing that, Deb, someone is asking about anxiety and under OHI. Someone says, I was under the impression that anxiety is not an eligibility.
I would say this. It depends on how it impacts the child, right? If you have a child with such an anxiety disorder that they can't be in a room with other children, the parents can't get them to the grocery store, can't get them to come to the table, they can't communicate with others because they're so wrapped up in their anxiety issues, it might rise to the level of OHI, but again, it depends on your state standards. So Roberta, you get to answer that one.
Well, you know, that we have that discussion in the big kids too, K to 12, because again, anxiety sometimes is associated with ADD, ADHD. It has that side.
Let me give a bigger answer. Let me give a better answer. So anxiety disorder as OHI, probably not as a standalone, right? But that's where developmental delay criteria could help support the notion that for that particular child, if there is enough impact on their development, then you could make them eligible in developmental delay, right?
Correct.
Let's say it's causing them not to be able to communicate with other people effectively. And maybe their social skills because of their anxiety is so high. So maybe you've got a 25% delay in social emotional, and you've got a 25% delay in language. Well, then that child's not eligible under the diagnoses of anxiety disorder and OHI, but they fit perfectly into a developmental delay category of eligibility. And that's why it's important to think about.
So
how developmental delay can be used.
In Mid-Coast, here's another comment. At Mid-Coast, we found social emotional domain of the BDI not to be sensitive enough. We have been combining the BDI with the DECA-C, and we found this combination to be effective in helping us determine DD eligibility, especially for 3-year-olds who have behavior concerns.
That sounds great. Thank you for that tip.
And we used, another one says we've used anxiety as developmental delay in the past, but not all 5 domains we've assessed, so we thought we could no longer. So
I'm going to say another overarching comment, and it is not meant to insult anybody. I worked in a physician's office for quite a while. There is a difference between Part C services more steeped in medical models and medical disorders, even though in most states they are moving away from the medical model of service, I believe including your state. But there's a difference when you get into the educational realm in Part B. We are much more focused on the impact for functional development and education. And that really is our laser focus, right? So we try really hard to stay away from these specific disorders. One of my pet peeves is talking about when we deliver our services, that we call them dosages. You know, it's very medical model-y. So I think we need to think of ourselves as educators, right? We're developmental specialists and development from an educational standpoint. And so again, it's not that some of the words we use aren't valuable, but I think we really want to help parents to understand the developmental impact on on how children are functioning within their everyday routines and activities. And it's important to use those kinds of words.
absolutely. Looks like we have a lot of input here.
This is great. And this will be a real help to you as you continue these conversations. All right, please keep typing. If you can type and listen at the same time, please keep typing. We have a lot of comments in the first box about what are the implications for your work and program practices. It would be nice to be able to consider DD more often in place of OHI for ADHD, etc., as I think it is hard to determine if that's an accurate diagnosis at that young age. Thank you for that comment. I absolutely agree with you. And I think that, you know, you can always get into some of these categories later of eligibility later on. And we really want to reassure our families in particular, services will follow the child, right? You don't have to have an autism diagnosis to get that intensive therapy you need if you need it, right? But for most children at this age, what we know about services for young children, particularly with autism, particularly to encourage communication, are the skills that classroom teachers, regular classroom teachers, are picking up and making their own. Those of you that work with the pyramid model and you're familiar with those strategies, you know that most of them came from special education, right? But now they're codified as regular kinds of strategies that we should be putting in place for children just because they're good practices. And because we know that the differences in young children are extreme, even if they're all on a developmentally appropriate trajectory. There's a lot of difference. In other words, we say that there's a span of 6 or 8 months when a child should have this skill, right? Let's go through these comments and have some conversation. Please feel free to speak up if you have a comment that you want to add or reiterate. And if anyone could not use this document, please speak up or put something in the chat. We will also be collecting the chat and Roberta's going to still read it. We need to look at environmental factors and how we can support programs without moving to eligibility. Love that comment. Maybe you can get more programs involved in the pyramid model. It is just an excellent, excellent way to look at providing services to young children. There's a comment here about many children aren't given IEPs for ADHD if there isn't some, I'm assuming, kind of need, some kind of testing. Okay, but I want to make it very clear. If you have a child that needs supports around behavior, right? Because We don't do medical intervention for children with ADHD. We do educational intervention. We can provide educational interventions, maybe not accessing funding in the same way. Let's make that clear, but we can access the services that a child needs educationally, regardless of a diagnosis and regardless of an eligibility category. Excuse me, 1 second. Okay. We agree with that. Does anybody want to make a further comment about that comment about IEPs for children with ADHD if there's not testing? Let's think about maybe looking at not the label of ADHD, but what are the strengths and needs of children that have that diagnosis that you would put on an IEP? What is a strength? What is a need? So when you put that need on the IEP, you can provide services for a child that's in developmental delay. You can provide the services needed to remediate that or to work on that. Make sense? And we need to have more discussion around that, I think. We need to look at environmental factors. Yep, we've talked about that one. I think I've already read it. Have a number of programs that are short-staffed and don't have the time to deal with problematic behaviors. We have looked to provide help for these kids so they don't get kicked out. Amen. In the end, accommodations is really what the child needs, but they have adjustment disorder. Okay. For many children, going into a classroom for the first time, particularly for young children, or being in a new environment, whatever it is, I'm going to say traumatic. I'm going to use that word. We've got to stop. I think we've got to start looking at what's happening for the child, not what label can we use to describe it. And I apologize. I know that might sound preachy. I think we use OHI or refer to psychovals to make kids eligible under OHI due to the pressure from public school systems, as they don't like kids coming into kindergarten with DD. Well, we need to do some in-service there. We need to have this conversation with our partners in Big B.
And again, that's one of the reasons why we're looking at extending the age, so there isn't that pressure to change that child during their kindergarten year.
Absolutely. Now, I would say this, it will be absolutely critical if you want to use this category to ensure that the people that are using the BDI are very well versed in what your state requires, what your state philosophy is, how your evaluations are going to be used, and that they are highly trained to use that tool. Because I'm going to say that tool, the BDI in particular, others as well, can be extremely misused if you're not following instructions, if you're not scoring it based on the right tables, right? Children in poverty should be looked at a little bit differently than children overall. It takes into account there's some standardization of those factors. Children who are English language learners, that's a whole nother subject, right, Roberta? Maybe for another day. Okay,
Correct.
let's keep going. There's also pressure from contracted providers and parents to get psych evals. But remember, parents are concerned about their children. Our job is to help them know all the facts, right? And so I'm assuming that there's probably a perception that a diagnosis or a label drives services, and it's just not so, okay? Let's see here. Diagnosis is that allows the child to be eligible for additional services. That's right, and that's a bigger conversation. I agree with you. I know your funding sources are very important. In most states, those additional services are clearly different than educational services, and they stay in separate buckets. And that is something that in your state you may want to address as well. We are no longer screening children, which means we're referring most for evaluations. Okay, let me say this about screening. I'm not suggesting you should screen every child, but here's one of the things about the Battelle that make it such a nice instrument for those folks that are highly trained to use it. If you do a Battelle screener, you are doing half of the elements within a domain. So you can do a screener maybe in 30 minutes for those kids that you're not sure what needs to happen next. When you decide, yep, they need X, Y, or Z eval, or yep, let's do a whole Battelle eval first. You incorporate your screening scores into your total score, and you don't have to, the screener that you do from the Battelle dovetails into the full eval so that you're not repeating those questions, but you're using those scores to come up with your final domain standardized scores. I hope I said that where you could understand it.
Let me clarify that a little bit for you, Deb.
Okay.
So we have since instituted the compliance of referral. So we have to, once a referral is made, we have to respond within 15 days. That's in our regulations. Instead of when the referral, what was happening before, there was a referral, then a screener and an observation and all of that before they were referred to the IEP team.
Sure. But that wouldn't preclude you from responding, but then saying, having a conversation about starting with the screening. Is that true?
You can meet as an IEP team and determine that you can do the screening prior, but you have to respond to the referral.
Okay.
And that we don't want that to interfere with the referral that was made and stop that
Absolutely
process.
That's a really good rule, and I really like that you do that. But again, it's about educating parents. It's about looking at typical development. It's about talking about why a child might be having difficulty and looking at those outside factors. Great point. Thank you for that comment. Public schools have asked us not to use DD category because that, yep. And that's what Roberta is saying that they're going to be looking at. It has also been suggested we not use that category when we are trained as administrators. I wonder why that is. Do you have any more information you could put there?
Well, that's because it's in our regulations, because it's the last disability of choice.
And you know what? I absolutely agree with that. But let's go back to that. Let's go back and visualize that slide with the categories that are appropriate, those first 4 categories. And look what the nation is saying they're thinking about and how they're handling those 4, main categories for young children. So really the 4 are autism, developmental delay, speech language, and other, right? If we wanted to lump all the others into other. So if you just look at those 4 categories and have this conversation, what's the best category between those 4? And again, if you've got a child with an orthopedic impairment, that's a no-brainer. If you've got a child with multiple disabilities, 2 or more of the traditional categories, that's a no-brainer. But look at those, just limit it to looking at those 4 categories in the gray area where you want to talk about what does that look like and why. And there is no reason to jump into the autism category of eligibility for those children for whom it is not abundantly clear meet that diagnosis, because that label will stay with the family forever. They heard it attached to their child. They've gone out onto the website, they've looked at things, they've probably been told things that are very dependent on the label and not the strengths and needs of that individual child. So I'm just saying, I'm not saying don't use it. I'm saying, let's be really careful and let's just talk and think about if this might look differently, because across the country, it does look differently for many children. Let's look at what you want to study further. How we place children in eligibility categories, teacher education on behavioral and emotional supports. I know your State Department's looking into that. Tools for determining social emotional needs, delays, and in addition to the BDI. And part of that's my lack of knowledge, but if we have a minute at the end, I'll try to get to that tool very quickly and show you where to locate it. Number 3, what might you need to change, if anything, and how would you go about changing practices? We need to change our practice when there is a FM concern. I'm not sure FM.
Fine motor.
Oh, thank you. If OT, oh gosh, you got that. You've got that down to a science. If OT evaluation does not satisfy them, I would say let's turn this around. Let's look at children and think of their development generally before we rise to the level of an occupational therapist, okay? Because developmentally, look very carefully at those motor skills, right? There's a developmental progression. And again, I'm not trying to insult any occupational therapist. They have a really key role in helping our young children, but they aren't the first line of looking at every child, even children with some motor issues, right? Motor rarely rises to the top as being the reason why children are struggling developmentally. We need to be sure we're requesting the motor domain to be completed as part of the 5-domain eval. I would say, and again, you all need to talk about it, you need to say, but I would say use a good general motor tool from a generalist perspective first, okay? RTI and general education interventions need to be evaluated and increased. Oh gosh, yes. We met with some states yesterday looking at what does specially designed instruction mean for preschool. Iowa has the most unbelievable structured 3-year training program for educators that are in the field, looking at what is developmentally appropriate practice, what are DEC recommended practices, then it moves into what is SDI, and finally it moves into how do we serve children to write IEPs based on SDI. It is amazing. Maybe later on we can take some time and look at that. I know you all would love it. It's amazing. But we are working to get more information out about specially designed instruction and what it is. Okay, it would be beneficial if Maine looked into providing RTI as a standard before moving to a special ed referral. I would say this about young children. I would say that using your early learning guidelines, having communication with families, talking about that wide range of skill development in young children, the younger the skill, the wider the range when we expect it to be implemented. I wish we had more time on today's call. There is a fabulous tool out of North Carolina that could really help with this that anybody can access and use. It takes developmental progressions, those individualized skills in between developmental milestones that might be in your early learning standards, and it breaks each one down to when is it expected, what is the range, what does it look like? When you're looking at a child, what does this skill look like? And for parents and providers, regular and special ed, how can we teach this skill? What supports can we use? It's phenomenal. Roberta, we'll put that down on the list to do another time as well. I think y'all would love it. We need to connect with our special ed providers, early intervention team, and other contracted providers in preschool so that they understand a bit more about all of this. You know, that is such a great statement because, again, without being judgmental about this at all, you are somewhat of a provider reliant Part B 619 system, right? So in some ways, schools do that part of being generalists a little better just because that's what they're steeped in. All right, again, absolutely no judgment being attached there. It's just a reality. As administrators, we facilitate meetings and guide the team in making determinations based on team member reports and evaluations. We would need to change how we interact with parents and teachers. Absolutely. I would be careful about using the word RTI with preschool. RTI is required for specific learning disabilities. It's more gray with other disability categories of eligibility. It's certainly an appropriate practice, whether you call it RTI or whether you call it part of child find. So with young children, I would embed those RTI principles within your child find, but you don't necessarily need to use the RTI words. I hope that makes sense. What are your next steps with staff? Review the PowerPoint and begin discussions. I would love to know what you think about that, what your staff think, what questions you have. Not sure I understood the conversation about a speech language pathologist. I understand an SLP is required to complete the speech language eval for a child, but is an SLP also required to participate in the 5-domain evaluation? I think if speech language services are going to be provided, I believe the answer is yes. Is that right, Roberta?
Sorry, I missed that question.
So the question is, it's about clarifying when a speech language pathologist is required to participate in a 5-domain eval. If there is a good, strong suspicion that the child will need individualized speech language therapy, then you would need to have a speech language pathologist do an evaluation. Is that correct?
Yes, that is correct.
A formal evaluation and be part of the signing off of the eligibility. Is that correct?
Correct.
Okay, great. Ongoing training with clear case studies. Oh gosh, wouldn't that be fun? Training with service providers, absolutely. Consistency between CDS sites would be great. Head Start and other ECETAs should be aware of the process. You are so right. This is something that y'all should do as a group as part of Child Find, right? It should be Child Find in eligibility. This is great. Trainings for child care centers to make more appropriate referrals. So again, that goes back to that North Carolina tool I was talking to you about. Roberta, if we want to follow up on this call and just do a fun conversation looking at tools that are out there and maybe having questions come in, we could certainly follow up and do that. We might not need 2 hours. We might make it in a more abbreviated conversation. But you all let us know if this is something that you want to continue to explore. We can do it sooner rather than later.
And I know that one of the things that we talked about the other day, Deb, about adding is around frequency and intensity. So that was, so we might want to see how we might be able to manage a couple of these topics into one training.
That sounds great. And I know you wanted to do maybe something around making making sound LRE decisions. Okay, I'm going to try and find one resource, and our time is getting short. Wow, it doesn't even look like my screensaver there. I don't know what's happening. Maybe I'm in the wrong place. If you all need to leave, I know we've only got a few more minutes. Thank you so much for your attention. For those of you that have 4 more minutes in you, I want to go to that evaluation checklist, that evaluation tool list, and show you that. There's also an excellent PowerPoint. I'm sorry, not PowerPoint. There's an excellent training webinar that was videotaped and is here. You might be interested in hearing that. It was done by Kathy Hebler, again, our expert in this area. We've also at ECTA, my partner from NASD and I have reached out and had discussions with leads from the Psychological Association or the Association, oh gosh, I don't know, the NASP, the National Association for School Psychologists, to talk about early childhood evaluation during COVID, and we can continue those conversations if they would be helpful. Here's our tools, but there is also a webinar that was videotaped. Let's see here. Here are screening tools, birth to 5 with potential for remote. Here are norm reference tools for children. Let's pop into this real quick. Make it a little bit bigger. And I was not writing down as often as I should have notes. So Roberta, if you can help me when we want to get all these resources together, we'll make sure that people get them. If you heard of a tool and you don't get that link, let us know.
Yeah, I saved the chat box.
The name and publisher's website is on the left-hand side, the age range, the possible assessment without direct assessment, how you can do that, administration details and notes, and then any languages or specific scoring information. This is an excellent tool. Let me show you all the tools that are on here. Quite a few. Here's the BDI, the Bailey scales, the BASC. These are all coming back to me from my early days. CSBS, the Connors, Developmental Assessment of Young Children, the DAISY. A lot of folks use the DAISY. That's the one I hear about. The Battelle, I think, is the probably most often used assessment tool in this age range for some children, followed by the DAISY. That's unofficial. I don't have data on that, but that's what I hear. The Devereaux, the DECA, whatever you call it. And so you can see that there is a wide range of tools that you may want to look at. So I hope this is helpful. This has been a lot of fun. Thank you so much for your participation. Please feel free to reach out with any questions you might have to Roberta or any ideas you might have for continued conversation. And I hope that sometime we can be in person and we can continue these conversations in a more natural format. So thanks so much for your time this morning. Roberta?
Yes, thank you so much, everyone. And I hope everybody has a great weekend. We'll be talking soon.
Have a great rest of your day. Bye-bye.
Thank you, Deb. That was awesome.
I love your groups. They're so wonderful.